Fishing for answers. What are biomarkers and what do they mean for me in my CLL journey? Biomarkers are specific features about you and your body systems that are measurable and can provide the details needed to diagnose and manage many different health conditions, including CLL and SLL. There are many types of cancer biomarkers that each have different functions. They can also make our bodies react in various ways to different treatments. Cancer biomarkers can include proteins, changes in your genes, which are also called mutations, gene rearrangements, extra copies or missing parts of chromosomes, and many other molecules. It's important to know that genes and cancer biomarkers are not exactly the same thing. Biomarkers may be produced by the cancer tissue itself or by other cells in the body in response to cancer. Some cancer biomarkers indicate how aggressively your cancer will grow to determine your prognosis. The most promising use of biomarkers in cancer today is their ability to predict which therapies will or will not help a particular patient. In order to determine what biomarkers are present in your CLL or SLL, your healthcare provider will need to send a blood or tissue sample to a laboratory to conduct a series of tests. Your healthcare provider can then take your test results and match them with published research by the world's leading researchers to identify which treatments are likely to work. 3 important biomarkers that should be tested in all patients with CLL and SLL include FISH, TP53, and IgVH. FISH stands for fluorescence in situ hybridization and is a test for chromosome abnormalities often seen in patients with CLL and SLL. The 4 most common findings are missing parts or deletions of segments of chromosomes numbered 11, 13, and 17, and an extra copy of chromosome number 12, which is called trisomy 12. On each of the 46 chromosomes, there are long and short arms that are named either P or Q. When the long arm Q segment is missing from chromosome number 13, this is called deletion 13q. Deletions of the long arm of chromosome 13 are the most common finding in those with CLL and SLL and are found in approximately 55% of patients. When the only chromosomal abnormality found by FISH testing is deletion 13q, this is the most favorable finding and indicates the disease will be slow to progress with a longer survival time. When the long arm Q segment is missing from chromosome number 11, this is called deletion 11q. This deletion is present in up to 20% of patients. It is most commonly found in younger male patients and those with enlarged lymph nodes. The 11q deletion is associated with high-risk disease and a more rapid disease progression. When the short arm P segment is missing from chromosome number 17, this is called deletion 17p. This rare deletion is present in only 5% of patients at the time of diagnosis. However, many people with CLL and SLL acquire deletion 17p over time as the disease progresses and after receiving certain treatments. Deletion 17p is associated with high-risk disease and poor outcomes. Individuals who have deletion 17p should not receive chemoimmunotherapy, as it will not be effective in treating their type of cancer. Chromosomes normally occur in pairs. When there is an extra copy of a chromosome, it's called a trisomy. About 10 to 20% of people with CLL and SLL have an extra copy of chromosome number 12, called trisomy 12. Those with this abnormality alone are considered to have an intermediate risk disease. However, if trisomy 12 occurs alongside other chromosomal abnormalities, it is then associated with high-risk disease. The TP in TP53 stands for tumor protein. The 53 refers to the number of the gene. The purpose of TP53 is to prevent cancer cells from growing. When TP53 is mutated, this means the tumor protein will not function appropriately in preventing the new growth of cancer cells, which allows them to grow more easily. TP53 is a gene located on the short arm of the 17th chromosome. Since it is located on the same chromosome arm where deletion 17p occurs, if 17p is missing, TP53 will usually be mutated, but it can also occur without deletion 17p. Testing for TP53 should still occur if deletion 17p is not present. Those with TP53 mutation are considered high risk and have a form of the disease that usually progresses rapidly and is associated with a poor prognosis. The number of new therapies for CLL and SLL continues to increase, many of which are proving to be effective even when the TP53 mutation is present. However, people who have the TP53 mutation should never receive chemoimmunotherapy, as it won't be effective in treating their type of cancer. It is also important to know the status of your IgVH gene. IgVH plays a role in antibody production, which helps the immune system protect against cancers and infections. When antibodies are needed to fight off cancers or infections, the IgVH gene is activated or mutated. So a mutated IgVH allows the immune system to work as it should. But it also serves as another biomarker that can help determine the prognosis for those with CLL and SLL. When the IgVH gene has mutated or changed, this is good because it means the gene has learned to function properly, so cancer cells will grow more slowly because they will have a harder time replicating. When the IgVH gene is unmutated, that means the gene has not become activated and is not able to help the immune system protect against cancers and infections. So those with an unmutated IgVH gene may have a more progressive form of the disease, but it does not necessarily have a direct impact on prognosis. IgVH rarely changes over time, so retesting this biomarker is generally not needed. Your IgVH status is essential to know which treatments will or will not work to combat your type of CLL or SLL. Those with mutated IgVH who are young and healthy may respond well to chemoimmunotherapies. However, those with unmutated IgVH should not receive chemoimmunotherapy because it will not be effective. In summary, it's important to have a good understanding of the necessary testing needed for CLL and SLL and when to have these tests repeated. As a reminder, the status of chromosomes and TP53 can change over the course of your disease, so FISH and TP53 will need to be retested again before starting each and every new round of treatment to ensure that the treatment will still work effectively for you. IgVH generally does not change over time, so you only need to be tested for it once, typically at the time of diagnosis or before your first treatment. Remember to test before treat, discuss the importance of obtaining these necessary tests with your healthcare provider, and advocate for your best possible care.